More than 40 million Americans have suffered from the coronavirus since the start of the pandemic, and more than 4 million of those cases were reported in the last 4 weeks alone. Some experts say the number of cases could be even higher than what is officially reported. And as the contagious Delta variant continues to spread, children are being hit hard. According to the American Academy of Pediatrics, kids now make up more than a quarter of the weekly COVID-19 cases across the country. According to the Washington Post, Miami-Dade County Public Schools have reported at least 13 employee deaths from COVID-19. That is since mid-August. All the employees are said to have been unvaccinated. This comes as Florida Governor Ron DeSantis enforces a ban on mask mandates and other precautions in K-12 schools across the state. So for more on this, we want to bring in urgent care nurse practitioner Justin Gill. Thanks for joining us, Justin. You heard the numbers coming out of Miami. More than a dozen staffers died, and this is just in the last month or so. Do you think it's time for Governor DeSantis to sort of rethink his approach towards COVID and schools?
Well, thank you so much for having me again this morning. I think my quick answer to that question is yes. I think that strength in our leaders is best represented by being able to recognize the problem that's in front of you and be able to take decisive action that meets the moment. When it comes to Florida and the case rates that we're seeing there, and with kids going back to school or getting ready to go back to school, this is a huge issue for not just parents, but children, other loved ones, elderly in households, especially as Delta variant is really kind of making its way throughout this country. I think that the mask mandate ban that was previously announced by Governor DeSantis was against the evidence that we had available, both anecdotal from our success with mask use, as well as from the literature and evidence of trials using masks. I think that he needs to meet this moment just as every governor needs to, as every parent is needing to when they're preparing their kids to go to school. I'm seeing patients that are coming into our clinic, going to school pretty soon in these next few days. And I get a lot of questions about this, about mask use and how the spread of the Delta variant can be prevented both in their household and in the classroom. And parents are anxious. It crosses political spectrums. It crosses regional spectrums. It affects every individual in a community, especially when you have kids coming together on a regular basis in a classroom.
Washington State, let's talk about that state. They've seen more than 91,000 cases in the last 28 days. The Washington State Hospital Association says more than 200 patients are currently on ventilators. Give us a sense of what you're seeing as you care for patients in the area.
Yeah, and I can definitely feel that impact on a day-to-day basis in my clinic, where we're starting to see a rising number of cases, primarily amongst individuals that are unvaccinated, but even a few mild or either asymptomatic breakthrough infections amongst people that are vaccinated. We are seeing that the patients we're sending to the hospital that need a higher level of care, may meet admission criteria, are unvaccinated, older or immunocompromised. But we're already starting to see people that are younger, that are unvaccinated, becoming infected with COVID-19 and having more serious illness that requires hospital admission. And that kind of runs counter to the perception of COVID-19 early on, where many younger individuals felt that they were not directly impacted or they wouldn't have any long-term effects. So it really highlights the need for making sure that we promote vaccination amongst our younger populations that are eligible for it, because it does affect their individual health in addition to the health of everybody that lives with them or stays with them. When it comes to forwarding patients over to the hospital, we do have some treatments now available. One of them being included is monoclonal antibodies. I do refer many patients that are higher risk and meet the clinical criteria to our local emergency department, where they can receive an infusion of that antibody treatment to improve their outcomes.
So we talked about Florida's approach to this. Where you are, Washington State, it's kind of the polar opposite. Washington State is moving forward with one of the strictest statewide vaccine mandates in the country. State employees, healthcare workers, educators, they all have to be fully vaccinated by October 18th, or they could face losing their jobs. So we know how you feel about Florida's approach. How do you feel about this stringent of a mandate in Washington State? I know sometimes people get uncomfortable with the idea of a mandate.
Yeah, I think that that's an excellent question because, you know, when you hear the word mandate, it oftentimes will trigger a negative response from many people. And I would say that with Washington State, the merit behind promoting this requirement for these specific professionals to be vaccinated, I think is a good thing. Obviously, there's some questions as to how you negotiate with particular labor groups or how you negotiate with particular groups on the best way to implement that mandate. But the merit of the mandate still is something that it can positively impact our response to the pandemic. We also serve as role models in healthcare for our patients. We need to stand by the evidence that we're promoting to our patients by getting vaccinated ourselves. And in addition to that, we need to maintain our own personal health because our healthcare workforce is stressed, it's short-staffed, it is going to continue to be stressed as we come out of this Labor Day holiday. So the best way for us to protect ourselves, as we tell our patients on a day-to-day basis, is get vaccinated. The merit of why we need to get vaccinated is there. We just need to make sure that we're promoting evidence-based science data amongst our own colleagues, in addition to the patients that we serve.
So, Justin, states that were considered hotspots last year are now dealing with a record number of hospitalizations because of the spread of the Delta variant. And now we're talking about the Mu variant, which has surfaced. Give us a sense of how this might impact first responders and their health.
Yeah, great question. I think that the variants that are coming out generally, raise alarm or raise concern. The CDC has raised it as a variant of interest, but not necessarily something that we're seeing as an immediate threat. Right now, we know that Delta variant is the predominant variant across the country by far. That doesn't mean we shouldn't pay attention to some of these other variants that are coming out. Oftentimes, we'll see reports that come out showing that some variants may be able to dodge immunity, either from vaccines or previous infection. Many of those studies are in vitro and not necessarily in the real world setting where we see actually that the vaccines still provide very strong protection against either symptomatic disease or high risk disease, severe disease or hospitalization.
All right, Justin Gill, always great to talk to you, my friend. Thank you very much.
Thank you.